Hi, welcome back to Community Hotline. My name is Monica Weitzel, and we're here at Metro East Community Media in Gresham, Oregon. And now for our final segment tonight, we're going to be talking with the Coalition of Community Health Clinics and specifically about the Wallace Medical Concern. And here to represent these organizations are Sam Chase. Thanks for being here, Sam.
Thank you.
And Lisa Klein. Now, Sam, you are the Executive Director of the Coalition.
Yes.
And Lisa, you're the Executive Director of Wallace Medical Concern.
Right.
Correct? And you're also on the board for the Coalition. So tell me, Sam, if I could start out with you, if you could tell me a little bit about the Coalition of Community Health Clinics, what the reason is for that organization, specifically what your mission is here in East County and all, it's all of the Portland area, is that correct?
That's right. It's the Portland region, and there are 14 clinics, and we're a coalition of those clinics to help them best serve some of our most vulnerable populations.
Oversee the clinics.
Absolutely.
So why exactly? I mean, what is the why is it important that we have this coalition overseeing these clinics, and why is it important that we have these clinics?
Well, it's important that we make sure that people have the best quality access to quality health care that they can. One of the things I like to think about is if you took all of the people who are living in poverty just in our region, it would be the second largest city in the state. Wow. Of course, folks don't live just in one city. They live in poverty. Right. They live all throughout the region. But for folks who are living in poverty, if you don't have access to health care, you can't get to your job, you can't support the economy, the tax base, you can't work on a regular basis, you can't take care of your children and make sure they're getting to school, help them with their homework, you can't participate in your community. So it really affects all of us if people don't have access to that health care.
And what happens to those people if they don't have health care? They're you know, if they don't have access to health care, they can't do any of those things, so they're not productive members of the community at all, and they're miserable people if they can even survive.
And it costs us all more, so it really benefits all of us when we can provide health care for everybody, and so that everybody has the opportunity to succeed. To me, that's what America was built on, is making sure people have that opportunity to help themselves. Well, if you don't have access to health care, you can't help yourself.
You can't help yourself. So Wallace Medical Concern, that's here in East County.
Right.
And and it's been around for how long, do you know?
Well, we've been around for 30 years.
Okay, I knew it had been a long time. And as part of the coalition, how long has the coalition been overseeing?
The coalition has been around for about 25 years.
About 25, okay, a long time.
So we've been a member the entire
for all
time.
that whole time. Yeah. So give me an example of some of the things you do at Wallace that are typical of what you do at all the clinics.
So we are a newly transitioned to providing primary care, and several of the coalition clinics provide primary care, and that means it's a full array of services, right? And we made that transition 2 years ago. Prior to that, we had really just been an urgent care clinic. And but whether it's urgent care or it's primary care, the thing that we've seen, especially out here in East County, is that folks who don't have access, haven't had access, when they come through our door, they're really sick. And they're not there for preventive care. They've delayed care and delayed it too long. And so that's the first piece around providing access to care for folks, getting them established in your clinic, and getting them comfortable and building a relationship, and then focusing on the wellness care. Okay. So in doing that, in getting them as part of your clinic, then you're going to have their records, and you're going to be able to follow them from then on and be able to track their care like a primary physician should do, right? I mean, be able to know that, okay, this person has these issues, and when they come in again, you check them. So the people that come to your clinic, is it like any other doctor clinic now that you provide primary care service, in that people come for regular checkups, or do they only come when they have an issue? Well, so the clinics, most of the coalition clinics do provide primary care, and so the goal is to establish a relationship with your patient, and so that they do come back for regular visits. So so let's say they first come in your door and they're sick, you want to address their major concerns, and then engage them in a relationship. So I would say that there's some really important pieces of a primary care home. One is that it's a relationship with the patient, and I said that before, but it's really, you want to be their home, you want to have a team that serves them, and that they feel a real connection. So you're the first person they call when they have a question. So it's getting them to a place where they can manage their care in partnership with you. So we call it patient engagement, but we really mean it too. It's a partnership. So they play a role as well. That's just as important, if not more important, than our role.
Right.
That's one piece. The other piece is that we see folks as a whole person.
Now, it's kind of going to be my next question. Do you address more than just their medical
Yes.
concerns?
And I would say that what makes, I think, the coalition clinics unique is that we really focus on meeting people where they're at and making sure that we respect where they're at. So cultural, the whole cultural competency piece is really important. Making sure that they understand what we have said to them when they're in the clinic. How many times have you left the doctor's office and you're like, gosh, now what did they say?
Well,
and do I take that 3 times a day, or is it once?
Well, now how does that work for you when you're in an area where there are so many different languages spoken and so many immigrant groups that have come to this area? How do you deal with that? I mean, that's rather overwhelming. That's hard enough for me, who speaks English as a first language in an area where that's the most commonly spoken language, to leave the doctor and not know what the heck happened.
Well, in some ways, that's where the coalition is helpful. The coalition really helps all of the 14 independent clinics work together throughout the region. But each of the clinics has different areas that they specialize and provide care. Some focus on specializing in helping homeless populations. Others are really culturally competent, like Wallace, around Latino populations, other Asian. And so one of the things that we do is help folks, we provide information and referral services. And so if you contact our coalition through our website, which is www.coalition-clinics.org, you can see what clinics are there, what services they have, and really help identify what is the appropriate clinic for you to get the best kind of care. You can also call our office at 503-546-4991 and also talk to somebody directly, and we help folks find
So
clinics.
you're able to get them to a place where they can get the help that they need.
Yes. And we also help provide interpretation services, and there are things that the coalition does that it really doesn't make sense for 14 separate coalitions to do. So we try to help provide an economy of scale around certain programs that will help support the clinics, and so we also help do some contracting around interpretation services. So if somebody comes in and is visiting a doctor, there's an opportunity to get some interpretation services that from folks who are really understanding about sensitivities that people might have in their medical conditions, and help them get through that communication process with their doctor.
That makes sense, how the coalition would help in that respect. The clinics, they are set up for low income or people without insurance. Explain that to me.
Well, a large percentage, 95% of the folks that are served by our clinics make below 200% of the federal poverty level. So there are folks that are really challenged with the economics of getting through their day-to-day life, and so often it's not just the medical issues, as Lisa was talking about, that they're struggling with. They're looking for housing. They have food insecurity issues. They have job access challenges, and so it's also kind of trying to help within the clinic settings to navigate all of those other challenges and help kind of give them some support.
Service kind of a referral or able to direct them toward those resources? I mean, do you have that capability to do that? We
do, and I would say a couple things related to that. One is that what's really nice about it being a member of the coalition is that we bring all these clinics together. We share resources. We share ideas. We learn from one another, so we don't have to reinvent the wheel. And
so you're not in competition with each other.
No.
You're working in collaboration with each other.
We're not in competition, exactly. And when I said whole person, it's really whole person within their whole life, within their family. So
and within their community, and so on and so on. Yeah.
I mean, if folks are having a hard time in other areas, if they're homeless and they have a health condition, it's really hard to manage a health condition if you don't have housing. If you're hungry, if you're, so many of the clinics assess families for how much food they have in the home and provide support there, make referrals for housing, as we mentioned. I know that for us, we connect folks to other social services that they might need. We're working on a relationship with another agency where they provide low-interest car loans. You know, that could be a major barrier. So, and the clinics, you know, vary in the kinds of additional supports that they provide based on their population.
That's great. So, are you still located are you in the Human Solutions building?
We are.
Yeah, which is a great example of collaborating with other organizations, because isn't there Loaves and Fishes are in
Loaves
there,
and Fishes and Head Start, Human Solutions, Metropolitan Family Services.
Which is, I mean, that's great. You really can't do anything without collaborating with your other nonprofits in the area.
Another really critical area that we've been working together with Wallace and all of our region's clinics is really around the enrollment opportunities that have been available in this last year, and working together to healthcare enrollment and getting folks to understand, hey, I've never had healthcare, and all of a sudden realizing that they can have access to healthcare, and that provides such a open door for them. And so we've helped coordinate with Wallace and others application assistance program. We have assisters.
Sure, huge help.
We have assisters that are competent in a number of different kind of languages and are available by phone and appointment. And again, by contacting our website, we can help facilitate connections to getting enrolled in healthcare. So if folks are out there that have not yet enrolled and have not accessed healthcare, they really should connect with us, and we can help connect them not only to healthcare and help them go through that enrollment process, which can be kind of daunting at first.
I think a lot of people are very intimidated by it.
And confused or have misperceptions of whether or not they're eligible. We have enrolled close to 1,600 people at Wallace with help of the coalition.
That's impressive.
They placed one of their enrollers on site. And you know, I'll tell you that we've had people come in who, when they learn that they're eligible, and then they learn what that means, what kinds of services that they're going to have access to, they're in tears.
I believe it. I believe it. Tell me, give me an example of somebody that you've helped, not with any names, but can you give me an example of somebody who's come to Wallace, just besides that has come in not knowing that they could get the help that you're able to offer?
Well, there's so many stories.
You know, I with one of your sisters was just telling a story just today, and there are so many of them, but about helping somebody who had a nerve condition that needed to be resolved, and the longer that they waited, the worse the condition was getting, but for a fairly simple treatment. But they didn't have access to health care. Well, they were able to get enrolled, and within just a few days, our sister helped really kind of lobby the state to make sure that enrollment happened quickly. They were able to get their operation and be, you know, taken care of within a week. So
something that would have been degenerative or chronic
was getting worse and worse, and they were not able to access the care they needed in a fairly simple procedure. So life-changing in that situation.
You say sisters. What? Explain that to me. You said something about your sisters.
Assisters. The enrollment assisters. That's the name of
the
positions that we have, and they're spread
okay.
around the region. The enrollment assisters they go to fairs, they go to events, but they also take calls and set up appointments right in our office.
Sisters everywhere that are willing to help
and be in different locations around the region. So geography and travel and those kind of challenges are there for people. We are able to reach out and meet people in places that are convenient for them.
What kinds of things do you have coming up in the future? You have other changes coming up that you're looking forward to doing with the coalition, or you have more clinics that will be opening up, or are you pretty much at a max right now?
One of the areas, you know, there are always areas that we are continuing to try and develop best practices for the clinics. That's one of the key roles for the coalition. Is you have 14 clinics all working to accomplish as much as they can, but not always having the resources to do it. So having an economy of scale to help solve some of those challenges is really important. One of the big challenges that we're trying to tackle is oral health. It's really surprising how many folks have oral health challenges that could be taken care of, but for access to the appropriate care and taking more preventative measures up front. So we're and it's the number one reason children miss school is because of oral health.
Really?
The number one
That's
reason children miss school.
I had no idea. Wow. And there's been so much in the news in the past couple of years about how if you don't take care of your teeth, that it can cause other problems like heart problems and things like that. Who would have thought, you know?
And job access. It creates problems with job access.
Well, sure.
You know, if folks are judged because of the condition of their teeth,
yeah, you're right.
It makes it a challenge, and,
you're right.
and it's not fair.
It's like, you know, your head is connected and your teeth are part of it, you know?
Yeah.
But it's really challenging for people to access dental. In fact, at Wallace we are looking to expand and add a dental clinic in partnership with Human Solutions.
Oh, great. Yeah, it's one of those partnerships are wonderful. Do you obviously you're a nonprofit, so do you're in need of volunteers? Do you use volunteers, or just, somebody wanted to donate, they had a little extra, and they wanted to donate? I'm sure you'd accept that.
Right.
Do you need volunteers for anything? Is it an organization that works with volunteers or not?
Absolutely. There's a wide range of areas where volunteers are needed. We have a very robust intern program at the Coalition, so it's a great opportunity for folks to get engaged in understanding and learning more about how healthcare policy works,
so
how
somebody wanted to get in that healthcare
the
field.
systems work, how you can get involved in the field. And we really try to give people, there's of course the day-to-day work that we need help with in the office, but we really try to give people exciting projects too.
Stuffing. Yeah.
So there's that. We also help connect, if somebody wants to work and serve in a clinic in some capacity, we can help try to facilitate those connections where folks are needed within our clinics. We have some events and other things where we put out our materials, and so
people
we have
can table and give out the information, let people know that those services are available, and that kind of thing.
We
Yeah, because I was at the Rock the Block event, and you know, Wallace Medical was represented there, and you know, they were giving out great information about the services that were available to people in the community. So, you know, people need to know.
Right.
And if there are any specialty care doctors out there, we always there's a tremendous need for folks who still don't have access to the healthcare to be able to access some of those specialty care.
If they want to give a little of their extra time, they could donate some of their time to help out.
And several of the Coalition clinics actually rely on volunteers. So, and Wallace relied on volunteers for 28 years solely.
Really?
Until we transitioned to primary care, and we still partner with our volunteers. So we have 300 volunteers.
Wow.
And we provide evening clinics that our volunteer physicians and other medical professional staff. Volunteer interpreters are really, really valuable.
Oh, yeah, I bet.
People who speak another language and willing to help out is very valuable. We're also looking at things that we really want to do, but we may not have the capacity to do, like more of the food justice work that's happening out here. And health promotion. You know, we offer yoga classes and NIA classes and Zumba classes, and there could be all kinds of opportunities for folks to volunteer to help provide access to folks who wouldn't otherwise perhaps have those kinds of resources available.
So if people are interested either at Wallace or if they live in another area where there's a clinic that the Coalition is managing, then people can go to the website and just check it out and give you a call or email you and find out what the opportunities are to volunteer. Or if they're needed some of the services, then go ahead and go to the website. It's probably the best way to go.
Well, and in fact, I know one of the Coalition clinics is looking for volunteer physicians right now, so I'll put that word out. PACS is looking for volunteer physicians, so there are opportunities.
There really are. And I would be remiss if I didn't mention that we have an annual event, and that is also on our website for details about that. But it's a great opportunity to come support the Coalition and our clinics.
Do you know when that'll be?
October 17th.
October 17th, okay.
And I would recommend going to the website just to
get all
confirm all the details. But it's a great event. It's a lot of fun. You learn a lot about the Coalition. You meet all the folks that are out there doing this really incredible work, and it's such a pleasure for me to have that event every year and highlight the incredible work that our members are doing.
Yeah, I can imagine. You do great work in the community and very well respected, I must say, in the community. So thank you both, Lisa and Sam, so much for being on tonight. Appreciate it. And if people have any questions, want to volunteer, want to get involved, we'll send them to the website. So
excellent.
Thanks.
Thank you so much.
You bet. Well, thanks very much for watching Community Hotline. Don't forget that we have these shows. We will be putting them on our website and on metroeast.peg, that's peg.tv. You'll be able to watch these shows within the next couple days. They'll be there. And we'll be on every week, so be sure to see us again next week. This is Community Hotline. I'm Monica Weitzel. Thanks so much for watching.